Hi, my name's Tom. I'm a manual osteopath from the UK, and over the last 7 years, I've treated thousands of people for lower back pain. Here's 5 things I would advise if you want to try and avoid it. This is number 1, which is how to stretch your hip flexors. First, we'll begin with psoas major, which attaches lumbar spine down into your groin. You're going to take a split stance, back foot on your toes, heel off the floor, hip and leg straight and just locked out. Front leg, shuffle forward, keep your balance. If you have to hold onto a surface, that's fine. Hands on your hips, keep your back leg straight, and then with the front leg, you're just going to bring your knee forward, and you should feel a stretch through the groin here. Really through the groin. Don't want to feel it too much through the quad, and if you feel it in your calf, then you need to take your heel higher up. If you're feeling this groin stretch, you want to hold it for a minute and do both sides twice. And then from here, you can progress it by just taking this foot further forward, knee further forward, and just getting your legs split further. The knee should stay behind the toes. So if you're doing this, you want to take this foot further forward, like so. This stretch is for rectus femoris, which is a second hip flexor. There's 4 quad muscles, 3 of them attach onto the leg, and the 4th one attaches onto your hip. In order to stretch this, we need to flex the knee and then take the leg backwards to get hip extension. To stretch rectus femoris, you can do it on the floor, but I'd recommend finding a table or just the side of a kitchen counter, something like this. You're going to stand roughly just behind it, and then take one leg, put your foot on the table. From here, you're going to stand up relatively straight. This is the knee flexion that we were looking for. Hand on your back, and all you're going to do is just gently lean backwards. Try and keep your lower back straight and have just the movement coming from your hip. Here, you should feel a stretch down the front of the quad, right in the center. If you do, then you're doing it correctly. For this stretch, hold it for a minute and do both sides twice. This exercise is called bird dog. It's going to strengthen your erector spinae muscles either side of your spine and also your glutes as a general muscle group. To do this, find a surface. You're going to want to go on your hands and knees. If you have wrist issues, you can go on your knuckles like so. From here, we call this tabletop, on your hands and knees, and then you're just going to lift one hand up and the opposite leg at the same time. Come back in, same on the other side, come back in. Same on the other side. When you do this, try to just come up to horizontal. You don't want to overextend your spine. If it feels a bit wobbly or that you just don't feel like your balance is great, this is normal. Just means the muscles can be a little bit on the weaker side or that your control is not as good as it could be. Practice this movement. Do 6 reps either side. Do that 3 times with about a minute break in between. Do that every second day, and you'll find your back will get stronger. This exercise is called clamshells. It's going to strengthen glute med specifically, which is a hip rotator, and it also stabilizes your leg. So if it feels like your knee buckles in or that your top right side of your hip at the back is hurting, can be because glute med is fatiguing. So what we recommend is laying on your side like so. Knees roughly 90 degrees, hip stays where it is, ankle stays where it is. Hand on the hip and just come and turn out like so. When you get to the top, you might feel like your hip rolls backwards. You want to avoid this. So push your hip forward, try and lift your leg against your hip. And then when you get to the top, squeeze, and you should feel it through here. This feels very easy. You can put a band between your legs, and then same thing, and have the extra resistance. And you'll find that this is a lot better. A test for this is if you can't really raise your leg up to the side properly, then it means that it's a little bit weak. So if you find you're only kind of going halfway or it's a bit of a struggle, then you want to strengthen this exercise. This exercise is clamshells. I would advise doing 3 sets of 10, and you might get away with doing this every day to begin with, but if you find it's quite sore, do it every other and give yourself a break. So 3 sets of 10, do a minute break in between and see how it goes. If you progress to adding a band, then I would drop it to every other day because you're going to struggle to fully recover, and over 4 or 5 days you might find it then gets sore and you need a rest day. This is how to hip hinge. When you lift something, you should be lifting with your knees and your hips, not directly your back. So the incorrect way to lift would be to just bend over like so with a fully flexed back. And then when you pick it up, that weight is going to go through your spine and it's going to shear forward. We want to avoid this. So the correct way to pick something up would be to bend your knees slightly, tilt with your hips, grab it, squat back up, and come up. If you learn to hip hinge properly like this, or like so, you're going to avoid this poor flexion at end range, and you're less likely to strain your back. Number 5, doing things in sets. Most people end up with lower back pain because they just push themselves too hard at once. So you might be shoveling snow and it might take you an hour. If you do an hour straight, your back is just going to fatigue because you've used it a lot in a short space of time. If you try and break it up, do 15 minutes, rest for 10 minutes, repeat this. It'll take you maybe half an hour longer, but you'll find you won't be as sore the next day and the likelihood of straining something drops significantly. If you found this video helpful and you would like any more content like this, drawing from the experience I've learned from treating thousands of people, then please comment below and I'll be happy to try and make those for you.